The Republic of China on Taiwan on Tuesday, August 21st, 2018, handed over a cash donation of some US $380,000 to the Ministry of Health, Wellness and the Environment for a capacity building project for the prevention and control of diabetes in a brief ceremony at the Ministry of Health conference room. The donation is part of a 3-year project and bilateral agreement which will assist the Ministry of Health in building capacity in fighting NCDs, specifically the prevention and control of diabetes here. The aim is to work together to implement management systems to tackle diabetes, influence lifestyle changes, and to show the serious approach of the partnership and support between SVG and Taiwan in reducing and managing the incidence of diabetes and making St. Vincent healthier. Why is this important to us? Because diabetes was ranked as the third leading cause of death in St. Vincent in 2016, with 86 or 9.3% death certificates listing it as the underlying cause of death. During the period 2012 to 2016, diabetes was ranked second in 2012 to 2014 and third in 2015 to 2016 as the leading cause of death. Over the last 3 years, there were 468 amputations secondary to diabetes. The toll, 34.8%, was the most common site of amputation, followed by below-knee amputations at 21.6%. In 2016, 1.6% of the population had diabetes and 0.11% of the population was diagnosed as new cases of diabetes in 2016. In 2016 also, there was a 3.3% prevalence of persons with diabetes and hypertension comorbidity, with 0.15% of the population newly diagnosed as having diabetes, hypertension, and comorbidity. The Ministry of Health, Wellness and the Environment appreciates and thanks the Republic of China and Taiwan for this wonderful gift, which would help the Ministry of Health, Wellness and the Environment in managing and controlling the incidences of NCDs, particularly diabetes here.
This is a very important project. It is focused on building our capacity here in St. Vincent and the Grenadines to be able to respond to the prevention and the control of diabetes in St. Vincent and the Grenadines. And it is a project which is jointly undertaken between the government and people of Taiwan and also the government and people of St. Vincent and the Grenadines. And today we are having a symbolic handover of a check from the Republic of China, Taiwan, to the government and people of St. Vincent and the Grenadines through the Ministry of Health.
I'm the project manager. My name is Chenhua Fan. I'm from Taiwan SDF. The capacity building project for the prevention and control of diabetes is a 3 years bilateral cooperative project. The total project is $2,031,096, of which about 90% funded by the government of Republic of China, Taiwan, through the Taiwan SDF and our cooperative hospital, Makai Maria Hospital. The project attempts to strengthen the diabetes management system in St. Vincent and Grenadines in terms of policy, healthcare facilities, and self-management. At this moment, 3 health officials from the Ministry of Health, Wellness and Environment are visiting Taiwan right now. They are visiting Taiwan for 2 weeks in order to understand and plan effective integrated care strategies on the prevention and control of diabetes for St. Vincent and Grenadines. And 8 instructors participate in a master training course to become a diabetes integrated care trainers at the coming October for 2 months in Taiwan. And HbA1c analyzer and the full care kits will be purchased as well. We gather here today to celebrate the fund of the first year is $76,000 has been wired in, and it will be rationed quarterly $380,000 in transferring to the project account this time. The fund will be used for above mentioned training course and instrument procurement as well.
It's on my way here. It's a beautiful day, so I'm very, very glad to be here at this handover ceremony. I will make a brief remarks about this project, but I have to admit one thing. Probably some people also like me that ignore one fact, that is diabetes has become a major threat to people's health. Correct me if my information is wrong. There's a statistic shows that 10% of Vincentian adults have diabetes, and this number will raise up to 20% for Vincentian adults over 40 years old. So this means that actually shows that the diabetes has already become one of the major public health issue to St. Vincent, and also it is also a common public health issue dealt by the governments in this Caribbean region. So under these circumstances, the government of the Republic of China, together with the St. Vincent government, initiated a bilateral project, which PS just mentioned. It's a capacity building project for diabetes prevention and control. And this project aims at the strengthening the ability to manage diabetes, and also strengthen through provide some assistance or resources to the medical facilities here. But most importantly to me is, it's one of the very important work under this project is to raise the public and community awareness for the self-care of this disease. So today at this ceremony, I'm going to hand over the $380 check to PS. That's the first quarter budget. We hope that through this humble contribution to this project, to the country, so that our Vincentian friends can no longer face, or at least release, the threat of this diabetes. So I wish that in the future that our Vincentian friends can be healthier in the future, and as I said, no longer to face the threat of this disease. So finally, let's work together with the ministries, our colleagues. Let's start today to make it carry out. Thank you.
I said to you earlier that this project is made possible through the kind assistance of the Republic of China and Taiwan. The priority which is given to health in St. Vincent and the Grenadines by the government and also by this ministry. And this project is also a way of demonstrating our seriousness in tackling these non-communicable diseases such as diabetes in St. Vincent and the Grenadines. I really want to appeal to all Vincentians, starting with myself. And just to repeat, diabetes is a lifestyle disease. Diabetes, as I understand, can be controlled. If possible, maybe prevented. So it has a lot to do with our choices, what we choose to eat, what we choose to drink, if we choose to exercise, and all of that. Taiwan has been reaching out to us significantly, not only in the area of health, agriculture, and others. We will have the symbolic handover of the check.
So we're here with Chang Hua Fang, and he's a project manager for the capacity building with NCBs here in St. Vincent and the Grenadines. Tell me, what exactly is it that you do to give us support in terms of NCDs here in St. Vincent and the Grenadines?
My name is Chen Hua Fan. I'm from Taiwan SDF. This project is a capacity building project for the prevention and control of the diabetes, right? And this project is conducted by our fake fighting group. They are from our cooperative hospital. They are the specialized in the NCD field. Yeah. So if I'm right, that's April last year, they came to St. Vincent Grenadines to investigate and to understand the situation here. After that, they prepared this project, and I'm here to operate according to their plan, their project. Yeah. So as a project manager to ensure this project can be done by according to their hope, right?
Okay. Yeah. So you're responsible for ensuring that everything runs smoothly with the project and that we achieve the outcomes.
Yeah.
Okay. How can Vincentians help you in the process of making this a success?
I think the most important thing is this disease is about choice. So Vincentians, they can make a right choice after we promote those health information to them. They can make a right choice about what kind of food they are going to take, what kind of how many exercise they need to have. So with those information that we promote.
Okay. Yeah. One last thing. For anything that involves lifestyle changes, people would complain about not having enough money to eat properly or to afford to do exercise. What advice do you give to them, or how can a project assist with that area?
So the health food is not equal to certain cost, right? We have many choices about health food. Even we can plant, we can grow on our own yard. So in terms of, we have Taiwan Technician Mission here. They are running agricultural project here, so they are able to provide any kind of planning, growing technique. Yeah.
Okay. New farming techniques to assist in terms of food planting and how you're able to eat.
So you can have health food in your backyard. You don't need to cost that much. Yeah.
Okay.
All right.
All right. Thank you so much.
Thank you.
All right.
Thank you.